Okay, so today we're diving into something, well, pretty fundamental in healthcare, something most of us have actually gone through, getting blood drawn.
Right.
It seems so simple, doesn't it? A quick poke, they fill a few tubes, and that's it.
Yeah, off you go.
But there's actually a whole lot more to it. The procedure itself, phlebotomy, it involves some really intricate steps, a lot of crucial knowledge.
Absolutely.
Yeah.
And because it's so routine, I think people often overlook the precision needed. But when you stop and think about the sheer amount of information we get from that small sample,
It's huge.
it really is. It highlights how important the whole process is.
Exactly. So our goal today is to really unpack that, look at how it's done, sure, but also why each step matters, the tools they use and how they ensure everything's accurate and, safe for the patient.
Mm-hmm.
And our sources really lay out the scope it's used for diagnosing infections, anemia, diabetes, checking cardiac markers.
Monitoring ongoing things too, like thyroid issues, kidney function.
Right. Seeing if treatments are working, those pre-surgery checks.
And of course, blood donation and matching blood for transfusions. Hugely important there.
And it's not just one type of professional doing this, is it?
No, not at all. The sources mention nurses, doctors, paramedics, lab techs. They're all often trained in phlebotomy.
Which really just shows how basic, how foundational this skill is across healthcare.
Totally. It's everywhere.
Okay, so let's get into the details, starting right at the beginning, prepping the patient. Seems obvious, but critical.
Oh, absolutely paramount. The very first thing, and our sources hammer this home, is positive patient identification.
Right.
Using at least 2 distinct identifiers, usually name and date of birth.
That sounds basic, but I guess getting it wrong could be catastrophic.
Exactly. It's the absolute foundation of patient safety. Prevents terrible mix-ups.
And then there's the communication part, just telling the person what you're about to do.
Yes, and that's not just being nice, though it is. Clearly explaining the procedure helps reduce anxiety, which makes a big difference.
Makes sense. Less stress, easier process.
Definitely. And as the sources note, sometimes you need formal informed consent too. Legally and ethically vital in certain situations.
It's about respecting their autonomy, right? Making sure they understand.
Precisely. They need to be aware of what's involved and agree to it.
Okay. Patient ID'd, informed, hopefully a bit less anxious. What about positioning? How should they sit or lie?
Yeah, the sources have clear recommendations. The ideal is either sitting comfortably or lying down.
Okay.
The key is having the arm well supported and extended, with the palm facing up.
Why palm up?
It helps expose the veins on the inside of the elbow and forearm, makes them more accessible.
Got it. And then comes the tourniquet, that tight band around the arm we all know.
Exactly. That's usually applied about 3 to 4 inches above the spot where they plan to insert the needle.
And the purpose is?
It slows down the blood flow out of the arm, but not into it. This makes the veins swell up or distend.
Ah, so they pop up more. Makes them easier to find.
Easier to see,
Yeah.
and crucially easier to feel, to palpate.
Which leads nicely into site selection. You can see lots of veins sometimes, but are some better than others?
Oh, definitely. Phlebotomists have preferred targets. Our sources point to the median cubital vein, that big one in the crook of your elbow.
Yeah, that's usually where they go for me.
It's often the first choice because it's typically large, fairly close to the surface, and doesn't roll easily.
Roll?
Yeah, some veins can shift under the skin when you try to stick them. The median cubital is usually pretty well anchored.
Okay. Any backup options if that one's not good?
Sure. The cephalic vein, which is more on the thumb side of the forearm, or the basilic vein on the pinky side.
But you don't just pick any old vein you spot, right? There must be places to avoid.
Absolutely. You steer clear of areas near an IV line, anywhere there's bruising, swelling, what we call edema, or any signs of infection like redness or warmth.
Why's that?
Drawing from those areas could cause more pain, lead to complications, or even mess up the test results.
Makes sense. And you mentioned feeling the vein, palpating.
Yes, that's critical. Our sources emphasize this. You gently press on the vein with your fingertip. You're feeling for something that's sort of bouncy and resilient.
Bouncy?
Yeah, it indicates good blood flow, a healthy vein that will likely yield a good sample. Not hard like a tendon or flat.
Okay. Found a good bouncy vein, avoided the bad spots. Next step is cleaning the skin.
Correct. Skin prep is vital for preventing infection. Standard practice is using an antiseptic wipe, usually an alcohol swab.
Just a quick wipe.
Well, the technique matters. Usually a circular motion, starting at the center of the site and moving outwards.
Okay.
And here's a key detail our sources mention, letting it air dry completely.
Oh, I've noticed sometimes wait a second. Why is that so important?
2 reasons. First, the alcohol needs time to actually kill the germs. If it's still wet, it hasn't fully worked. Second, poking through wet alcohol can really sting the patient.
Ah, right. Okay. No stinging and maximum germ killing. Makes sense. Skin's prepped, dry. Now the actual insertion.
So this is where the skill really comes in. First, you anchor the vein.
Anchor it.
With the thumb of your non-dominant hand, you gently pull the skin taut, just below the puncture site. This stops the vein from rolling away as the needle goes in.
Okay, hold it steady.
Exactly. Then, the needle insertion itself. It should be bevel up.
Bevel up, meaning the pointy opening is facing upwards.
That's right. And the angle is important, usually pretty shallow, between 15 and 30 degrees relative to the skin.
Why that specific angle?
It's sort of the sweet spot. Steep enough to enter the vein cleanly, but not so steep that you risk going straight through it or hitting nerves or arteries deeper down.
Got it. And then getting the blood out. I've seen them use different things. Sometimes tubes that fill themselves, sometimes a syringe.
Yeah, two main methods. The vacutainer system is very common. It uses a special needle holder and vacuum-sealed tubes.
How does that work?
The needle has 2 points. One goes in the vein, the other pierces the rubber stopper of the tube inside the holder. The vacuum in the tube just sucks the blood right in, automatically filling to the correct level. Then there's the syringe method. You use a standard needle and syringe and gently pull back on the plunger to draw the blood out manually.
When would you use a syringe instead?
Maybe for patients with very fragile or small veins, where the vacuum pressure might be too strong and cause the vein to collapse. Or if you need a very precise, perhaps smaller amount of blood.
Okay. Now, something really crucial you mentioned earlier, the order of the tubes.
Yes, the order of draw. This is critical. Different colored tubes contain different additives, anticoagulants to stop clotting, preservatives, clot activators.
Right.
If you fill them in the wrong sequence, an additive from one tube can get transferred via the needle into the next tube, contaminating it.
And messing up the lab results?
Potentially, yes. Bad results could lead to wrong diagnoses or treatments. So there's a very specific standardized order based on the tube top color and additives.
Fascinating. Our sources didn't list the exact order, but that precision is amazing. Something to maybe explore another time.
Definitely. It really shows the layers involved.
Okay, tubes are filled correctly. How do you finish up?
Several key steps for completion. First, release the tourniquet before taking the needle out.
Ah, important detail. Why before?
If you leave the tourniquet tight when you pull the needle, blood can be forced out of the vein puncture site into the surrounding tissue, causing a bruise or hematoma. Releasing it first reduces that pressure.
Got it. Tourniquet off.
Yeah.
Then needle out smoothly.
And immediately apply firm pressure with a sterile gauze pad right over the site.
How long do you hold the pressure?
The sources suggest the patient should hold it for at least a minute or two, maybe longer if they're on blood thinners, just to make sure the bleeding is fully stopped.
And then the little bandage or tape?
Yep, once you're confident the bleeding stopped, apply a bandage to keep it clean.
Seems straightforward, but crucial steps. And the job's not quite done yet, is it? Post-procedure tasks.
No, definitely not. Labeling is absolutely vital. Our sources stress doing it right there at the patient's side before you walk away.
Makes sense. Avoids any chance of mixing up samples later.
Precisely. Label every tube clearly with the patient's identifiers. Then, safe needle disposal into a sharps container immediately and critically. Never try to recap the needle.
That seems like a basic safety rule.
It is, but so important to prevent accidental needle stick injuries. After that, clean up any supplies, make sure the patient's feeling okay, thank them.
Little things matter.
They do. And finally, documentation. Record the procedure in the patient's chart, what was done, which site, how the patient tolerated it. Essential for the medical record.
Right. Now, throughout this whole process, safety for both patient and phlebotomist is obviously huge. Infection control.
Non-negotiable. Wearing gloves is standard, of course.
Yeah.
Good hand hygiene before and after contact is fundamental.
Standard precautions.
Exactly. We mentioned safe sharps disposal. That's huge. And reporting any needle stick injuries immediately is critical for the healthcare worker's safety and follow-up.
And just the overall approach.
Maintaining a calm, professional manner. It reassures the patient, which can actually contribute to safety by keeping them still and cooperative.
It sounds like despite the training, there are still common mistakes that can happen. What should people watch out for?
Yeah, our sources list a few common errors. Choosing a bad vein, like one near a joint, or maybe even mistaking an artery for a vein that's dangerous.
Ouch.
Forgetting to let the alcohol dry completely is another one we talked about. using the wrong type of tube for the test ordered, or using expired tubes.
Can expired tubes affect the results?
Yes, the vacuum might be lost, or the additives might degrade, leading to inaccurate results. Also, if using a syringe, pulling back the plunger too hard,
What does that do?
it can actually damage the red blood cells, break them open. It's called hemolysis, and that can interfere with many lab tests.
Interesting.
And the big one, again, not labeling the samples right away at the bedside. That's a major potential error.
So lots of little things that add up to accuracy and safety. Now, are there special adjustments needed for different types of patients? Kids, older adults, anxious people?
Oh, definitely. Phlebotomy isn't one size fits all. For kids, you'd often use smaller needles, like a butterfly needle, which has little wings to hold on to and thinner tubing.
Makes sense.
For very young infants, sometimes a heel prick is used instead of a vein puncture for tiny samples.
Okay. What about elderly patients?
Their veins can be more fragile, thinner skin, maybe more likely to roll. So again, smaller gauge needles might be better, a gentler technique, perhaps being extra careful with tourniquet pressure.
And for someone who's really nervous, maybe has a needle phobia.
Communication is key there, explaining clearly, being empathetic. Distraction techniques can work wonders talking about something else. Reassurance, a calm presence, it all helps.
So it's technical skill combined with good patient care.
Exactly. You need both.
Okay, so pulling this all together. Phlebotomy. It looks simple, maybe feels routine if you have it done often, but it's really a foundational healthcare skill. It demands precision, knowing the protocols inside out, following them every single time.
And always focusing on the patient, their safety, their comfort, their specific needs.
It really underpins so much in medicine, doesn't it? Diagnosis, monitoring health, checking treatments.
Absolutely. Across pretty much every medical field. It's that crucial first step in getting so much vital information, a critical link in the chain of care.
So maybe the next time you're sitting there waiting for that little poke, you can, appreciate the expertise involved.
Yeah.
It's definitely more than just a quick jab. It's a really intricate, important part of your whole healthcare picture.
Well said. It's a testament to the skill of the nurses, the techs, the doctors who do this day in, day out.
And perhaps something to think about is just how much incredible diagnostic power we get from such a seemingly small, simple sample of blood. It's quite amazing when you reflect on it.